I'm Sara Allin. I'm a senior researcher at the Canadian Institute for Health Information. That's a not-for-profit organization funded by federal and provincial governments. And what we do is collect and set standards for administrative data from all the province's health systems, and we conduct analysis on health policy issues to improve health system performance and ultimately the health of Canadians. I'm also a status-only assistant professor with the University of Toronto, and I contribute to teaching there on health policy courses for master's and PhD students.
So how would you define long-term care in Canada? Because obviously long-term care means different things to different people and in different countries.
Yes, so long-term care means even different things within Canada across the provinces. So generally, it includes all residential care that is provided to people in need of supports, whether for health or social services. It also includes home services that will be provided by nursing and health professionals, but also by personal support workers to assist with activities of daily living. So it's generally divided into the residential sector and the community sector. And the terms that are used for describing those residential facilities, they vary across the country. Sometimes they're called long-term care homes. Sometimes they're called old age homes. There's variation across the country. So that's pretty standard in Canada. That I'll probably answer everything with some kind of disclaimer that there's no single definition or single policy that applies to the whole country. But in general, did you want me to describe long-term care, how it's delivered and what's covered? Is that...
You can, yeah.
Okay. So the healthcare in Canada is highly decentralized. So the provinces and territories primarily have responsibility for organizing their health systems for the residents in their province. And many have further devolved decision-making to regions that then plan and deliver health services and long-term care services at a more local level. And the provinces, they run their own health systems, but they receive some funding from the federal government, and these cash transfers are conditional on a set of conditions outlined in legislation called the Canada Health Act. But these conditions only apply to medically necessary services, and those are defined broadly as physician-delivered services and care that's delivered in hospitals. And the conditions are that it must be universal, there must be no financial barriers to access, the insurance program should be publicly administered, and coverage should be portable across provinces. But long-term care services are not considered medically necessary according to that definition. And so the same conditions do not apply. So as a result, long-term care coverage varies across the provinces and even within provinces. So even though there's no requirement from this legislation for provinces to fund and deliver long-term care services as part of their insurance program, they all do, but there's limitations in what is covered that's not universal in terms of, in comparison to health services. So there's a huge discrepancy between the universality of the health system and the coverage that varies and is limited to based on assessment of need for long-term care, and it's also limited in supply. And so there's quite a significant private sector alongside the publicly insured long-term services. And generally, the provinces cover residential long-term care, but they require the residents to cover the accommodation costs. And home health care is generally covered publicly, but not social care. So there's much more private sector for the social services than for home health, like nursing services, for example. And to access long-term care, there's generally a needs assessment. It's not typically based on income, although there might be some income scaled contributions, and depending on the province. And usually this assessment is based on health status and functional impairment, usually with a form of the resident assessment instrument. So in general, publicly funded home care is limited based on supply, and people rely heavily on the private sector, but also on informal care. So estimates suggest that in Canada, about 70% of home care supports is provided by informal carers.
Okay.
So that's kind of an overall
Okay.
picture of long-term care in Canada.
So I know you said that, Canada obviously is very diverse, but would you be able to point to 3 policy priorities in Canada when it comes to long-term care?
Yes, generally, my perspective is usually from Ontario, but I see a lot of common priorities across the country, but I'm speaking mainly from the perspective of Ontario. So we may see differences, but generally there are some common priorities that I can identify. And the first, I would say, is this interest in keeping people out of hospital. So there's been a lot of investment in long-term care with the view of relieving pressure on acute care. So it's not for long-term care improvement per se, but in recognition of the costs of hospital care being so much higher, and the appropriateness is often not there, because people are in hospital who have been identified as not needing acute services, but rather needing long-term care services, but have been unable to find the care they need in the community or in residential care. So this policy priority has increased in recent years, where which we can see there's been a lot of investment in home care. For example, in Ontario, funding for home care has more than doubled in the past decade, and that has been often framed as as being able to reduce pressure on hospitals. So getting people out sooner and keeping them from being admitted in the first place. A second policy priority, I would say, is around quality of care, and in particular in institutions, in residential care. So there's been an increase in new legislation across the provinces and improving quality of care. In Ontario, for example, they've introduced these unannounced inspections, and also there's an increase in public reporting on performance in long-term care sectors. So an increase in the data that's available across facilities in order to compare and then to identify where improvements are needed, and that kind of benchmarking that can drive performance improvement. And then a third priority, it's slightly connected to the first, but I would say it's around improving the coordination and integration of care across sectors and across sort of hospital and community and long-term care sectors. So that integration is an area that's been identified in Canada as deserving a lot of attention. There's huge challenges there in terms of both the communication among the providers, the lack of communication really, and difficulties for patients in navigating the system in those transitions. So in particular, transitions of care have been identified as a priority for attention. And so there's been some movement towards addressing those challenges, but it's a huge, one of our main challenges in Canada, in the way that health and long-term care services are funded, has created some of these sort of siloed sectors that haven't been very well integrated. So I would say those are sort of the top 3.
Okay, and have they changed over the last 5 years, or are they kind of constant?
I would say that in the past 5 years, there's been a huge budgetary pressure faced in provincial health systems. So there's been an effort to keep budgets constant. So we can see that health expenditures broadly have not been increasing in the last few years, since the recession of 2009. And so that has forced long-term care to be a bit higher on the agenda in terms of what I'd said previously about relieving some of the pressure on acute care, which is seen to be more expensive. So identifying more cost-effective ways to keep people healthy and in community. And quality has become more important recently, and the organization I work for, Canadian Institute for Health Information, has published for the first time this year comparable quality indicators across long-term care facilities across Canada. So not just within a province, which may have already had some reporting, but not much actually. It's a sector that hasn't received a lot of attention in terms of public reporting. So this new effort to improve the sort of transparency and accountability within long-term care is pretty recent. And some of the indicators we can look at are, for instance, the potentially inappropriate medication use in residential care facilities, use of restraints, and estimates of functional decline or improvement. So these are, it's a pretty new initiative to be able to compare these indicators across facilities and drive improvement that way. So I would say that, the budgetary constraints have kind of forced long-term care a bit higher up on the agenda, although investments in home care, we can see have started to increase over about the past decade. So it's been increasing, and the intention has been building for longer than the past 5 years.
If you, Sarah, had an opportunity to introduce one policy, what would that be?
I would say I would focus on this integration challenge. So we have some examples in Canada where there are sort of pilot projects or small scale projects that attempt to integrate the hospitals with the community care providers, with residential care providers, and to increase communication to allow for transitions to be smoother. So I think that's really a priority for Canada, and it could be facilitated with better data, like electronic medical records could be one tool to allow for better communication and integration. And that's an area where Canada's been lagging behind other countries. We're usually like the bottom of the ranks in terms of use of EMRs, even within primary care or within hospitals. We're still behind, let alone across those providers. So I think that could allow for much more, at least awareness of the pathways that patients go through. And so the providers in the different sectors can communicate in a more timely fashion to facilitate those transitions.
In terms of research, do you think there are any particular priorities for conducting research on long-term care in Canada?
Well, related to that point, I would say that evaluation of these kind of pilot projects would probably be the most important way of then building evidence to scale them up. So, for example, in Ontario, there's been over the past few years some pilot projects around bundling payment. So instead of paying providers fee-for-service for their services in the hospital and then paying hospitals a global budget and then paying community separately, they've identified for certain population groups a single payment that could cover the needs of the patients from the hospital as they go into community. And this kind of approach could be helpful to improve integration, but we need to evaluate it. So research that evaluates this type of program or evaluates other areas of change, which include, for example, giving patients and their caregivers funds to pay for their own health and social care needs. So this is very new in Canada. I know it's been in place in other countries much longer, but in BC, we have this option for this more self-directed care option where they're given the funds directly. And in Ontario, they're just introducing it now. So these require evaluation to see what impact it has on quality of care, on outcomes. So evaluating pilots and scaling them up is kind of our, we're very good at introducing pilots in Canada, but then taking it that next step further is usually a challenge.
Okay. Well, I'm going to ask you a few quick questions, and I'm looking for a number of responses from 1 to 10, where 1 is low and 10 is high. So first of all, what policy priority do you think is allocated to long-term care in Canada?
7.
7.
I think it's high mainly because of this need to shift people out of hospital.
What about the awareness of general public? How do you think how aware general public is about what's available for them in terms of long-term care?
3. It's low unless you have a need yourself or a very an aging parent. I think there's very little public awareness.
Okay, but if you have needs, the people who have needs, do you think they quite aware of what they can get from the system?
Yes, once they enter the system, and usually there's a place where they can like a local organization that can coordinate care for them and do the needs assessment, and I think that's fairly consistent across the country in terms of having that single point where they can find out what's available to them, but usually that's pretty limited and they need to seek private options, and that's not coordinated, and there's a huge learning curve that people go through once they even enter the system. So it's not well known in the public, and then it takes a lot of work to learn it once they're in the system as well.
Okay. So how well do you think that the long-term care system actually supports people with long-term care needs?
5 maybe. It's fairly good. It's not great. It's limited because of supply. So they might get some of their supports that they need covered, but there's limited coverage from the public system, and they tend to rely heavily on informal and private care as a result. So it's partial, but it's universal in theory, but in practice it's pretty partial coverage.
And how well do you think carers are supported by the long-term care system?
2.
2, okay.
It's pretty poor. Yeah.
Okay.
I think it's probably improving over time, but it's an area that deserves a lot of attention here.
Okay. And I mean, you talked a little bit about the integration, but how, what number would you give for the integrated services in terms of long-term care in Canada?
3.
3, okay.
Yeah. One of the main reasons for that is that physicians are outside of the regional sort of system. So I mentioned at the beginning that provinces have many of them have devolved budgets to regions in order to coordinate care for the local population, and they do that for both health and long-term care services. But physicians aren't paid by the regions, they're paid by the province, and they're paid mostly fee-for-service. So that exclusion means that primary care is not closely connected with long-term care.